A very good evening, everyone. My name is Payal, and I welcome you all to WeTalkDoYou, a show by Puberty to Menopause, a public health awareness initiative by Human Biologicals Institute. Human Biologicals Institute is a division of Indian Immunologicals Limited (IIL), which was established by the National Dairy Development Board (NDDB) in the year 1982 as its unit, and later registered as a company in the year 1999 with the name Indian Immunologicals Limited. Human Biologicals Institute was established in the year 1998 when the Government of India requested IIL to produce a modern tissue culture anti-rabies vaccine to phase out the unsafe nerve tissue vaccine. The first manufacturing facility of Human Biologicals Institute was established at Ooty. The facility is one of its kind in India to have rolled out first Vero cell culture rabies vaccine in the year 2000. Subsequently, Human Biologicals Institute launched other vaccines, and currently we are the major player in human vaccines. We are leader in anti-rabies vaccine segment and present in around 50 countries, with three state-of-the-art manufacturing facilities at Ooty, Gachibowli, and Karkapatla, also known as Geno Valley. Human Biologicals Institute has also forayed into the market of clinically proven wellness products and infertility range of hormones. Our vision is shaping global healthcare by spearheading the One Health initiative. Our mission is to innovate, produce, and market quality healthcare products and services to improve and extend lives. We believe in providing affordable products with high quality through continuous technical innovations and improvements to meet our customers' need. We're very proud to share about our green initiative. As a market leader, we have taken a significant step to reduce the plastic burden by 160 tons per annum by introducing eco-friendly packs of our flagship brand. As an organization, we take our corporate social responsibility very seriously. Either it's adoption of government schools, where IL has adopted many government schools where IL is providing infrastructure and basic facilities, including help in the midday meal program. Our association with NDTB through a gift meal program. Many school-going children from Telangana and Tamil Nadu are benefited. IL has donated oxygen generation plant to TIMS, Telangana Institute of Medical Sciences. These are few corporate social responsibility I'd like to mention here. For more information, you can also log on to www.indumin.com. Once again, I welcome you all to today's show of We Talk to You, where we are going to talk about a very important topic, polycystic ovarian disease, PCOS, commonly known as. It's a very complex metabolic condition that is often not diagnosed very early enough. In one of the study, it was found that for women with PCOS, almost 50% saw three or more health professionals before being appropriately diagnosed. And for about 33%, it took over 2 years before the diagnosis was made. PCOS is not just hormonal, but also an inflammatory and metabolic condition that over time can lead to diabetes, heart diseases, fatty liver diseases, and also infertility. If PCOS is troubling you and you're popping one pill after the other, there are ways through which PCOS can be reversed. So to discuss about this very important yet common topic, we have a very special guest with us today. I would like to welcome Dr. Alok Kumar Moulik from Kolkata, West Bengal. Dr. Alok Kumar Moulik has received many awards like Swasthya Samman in the year 2016 by the Honorable Chief Minister of West Bengal. He has been conferred with the highest performing surgeon on NSB, World Population Day 2014 and 19. He is one of the best performing medical officer, Chanditala Rural Hospital from 2003-2007. He's currently practicing in Barasat Government Medical College and Hospital. With this, I would sincerely welcome Dr. Maulik in today's program. Dr. Maulik,
Thanks. Good evening, ma'am, and other professional colleagues. I am Dr. Alok Kumar Moulik, discussing the one of the burning issues of the world from the one of the capital of polycystic ovarian syndrome, that is India. You already know that China having the largest number of people in this planet. Among the 7.8 billion people living in this planet, China bears the largest burden of the people, 1.40 crores. And India, about to touch the milestone of China, 1.39 crores. Among these 1.39 crores, 51% of the male population and 49.73 is the female population. And in this female population, the age group, that is reproductive age group, 15 to 44 years, is the vulnerable age group for polycystic ovarian disease or Steen-Leventhal syndrome, PCOD disease. So, I will discuss this matter, one of the burning issue of the modern planet today,
great,
with some important features. How to
great,
early diagnosis and how it can be reversed by dint of hard labor and lifestyle modification. Within lifestyle modification, main regime is dietary regime. Next comes to exercise and other healthy practices. So, our first question is, what is PCOS?
yes,
Polycystic ovarian syndrome. It is a metabolic reproductive syndrome in short, or hyperandrogenism with anovulatory or dysovulatory syndrome. It was first detected in this world in 1721 in Italy. Next, in the year 1935, Irving F. S. R. Steen and Michael L. Leventhal, two gynecologists, United States of America gynecologists, discovered this disease. And according to their name, the disease is also called Steen-Leventhal syndrome. It is mostly victimize the female population within the age group of 50. And first and foremost symptom is infrequent menstruation, amenorrhea, hypomenorrhea. Amenorrhea, the normal female's period is 28 days plus minus 2 to 4 days. But in this metabolic syndrome, it is not a disease, it is a metabolic syndrome. In this disease, the period may be longer up to 6 months, 8 months, 9 months, even 10 months. And when the menstrual period starts, it will take longer course and progressive pain and prolonged menstruation, bleeding, clots. These are the main symptoms. Due to male hormone androgen hyperactivity, hypersecretion, hyperandrogenism in single word. Next comes to hyperinsulinemia due to insulin resistance. Most of the cases, more than 50% of the patient is obese, overweight. Their BMI is more than 28
okay,
at least. So the receptor blockade action of insulin, there is sufficient amount of insulin plasma, but they cannot work properly. So it is a type of insulin resistance. In a single word, I can tell you, and insulin resistance causes type 2 diabetes mellitus. Also, one of the main female hormone is progesterone. progesterone level of the plasma also comes down. So, androgen takes the upper hand and the female become a male type of hair growth all over the body, particularly facial hirsutism, which we can diagnose by seeing that lady.
Okay.
Nose, beard, multiple hair growth over the face, anterior abdominal wall, particularly chest wall, buttocks, and limbs also. It is a social problem and disgusting condition for a lady to bear such amount of hairs. Exact cause of this metabolic syndrome or metabolic disorder is not known to us till today. Most probably it may be genetic, it runs in families, or some undetectable unseen factors of the environment may cause this disease. And role playing factors in cases of hyperandrogenism prevents ovulation and irregular menstrual cycle. And it is, though it is not a life threatening condition or serious disease, but this disease suffers a lot of the female population. Ultimate, finally, it causes few metabolic syndromes like diabetes mellitus type 2, acne, pustular acne, fatty liver,
Okay.
and other metabolic diseases of this condition is overweight, obesity, hypertension, even heart attack. This is the actual facts of PCOS. Next is
Dr.
cause.
Maulik, I'm sorry for interrupting you in between. Thank you so much for explaining in brief for what exactly PCOS is and telling us how common it is these days.
Uh,
Meanwhile, before we move on to our next questions, where we would like to know more about the symptoms and signs that a lady can know that she's suffering from PCOS, I would like to request all our viewers who are watching us live today, if you have any sort of questions that you would like Dr. Monique to answer by end of this discussion, you can please put it in the comment section, or you can also inbox it to us. We will take up all the questions by the end of our discussion with Dr. Maulik. Thank you. Uh,
causes
yes,
causes
Dr.
of the
Maulik, coming to the symptoms and what causes, what can be the possible causes of PCOS?
I am already telling you the causes. It may be genetic, it runs in families, it may be environmental factors will influence the etiology in the etiology of the PCOS. This is the main causes of PCOS,
Okay.
hyperandrogenism, which can uh, thicken the ovarian cortex, and thickening of the ovarian cortex and cyst formation due to a high androgen level in the plasma. The ovulation cannot occur, or anovulation occurs, or dysovulatory syndrome is also the name of PCOS. Hirsutism, excess of hair growth in unwanted places, in unwanted time, and weight gaining, particularly one of the most distressing symptom is scalp hair loss in
Okay.
cases of female, and thinning of hair, scalp hair, and pustular acne. I always also informed you. Central obesity, pot belly, belly bottom is prominent, and obstructive sleep apnea, which is another important sign. Mood disorder,
Okay.
heart disease, even endometrial carcinoma, which is caused by the hyperandrogen and estrogen. Estrogen takes upper hand due to lack of progesterone secretion. Mental trauma, insult for infertility, primary infertility, mental trauma, even mental social torture by the relatives, near relatives, and even the ill-educated or uneducated females may cause suicide due to this torture. And how PCOS affects your body? Body configuration is changed. Obesity, central obesity, diabetes mellitus, pustular acne, heart disease, endometrial carcinoma, every system can affect with this dysregulatory endocrine metabolism, metabolic syndrome. So we will be cautious enough to maintain this, and uh, early abortion, first trimester abortion, abortion within first 3 months of pregnancy is also a prominent feature of PCOS. At least 3 times more chances of early trimester abortions in cases of PCOS than normal. Normally, 10% pregnancy cannot fruitfully uh, persist till delivery. 10% fetal loss, abortus loss is uh, fixed almost. 30% it will may increase up to 30-40% in cases of PCOS. And there are some drugs, that is treatment. First thing is lifestyle modification, which is very, very important to control the androgen level. Number two is anti-androgen medication like spironolactone. Use of anti-androgen shampoos and heat suit. The abnormal hair growth can be controlled by Alexandra lasers, 755 nm wavelength pulsatile light therapy for to distract the hair follicles of the abnormal hairs. Others, laser therapy or electrolysis is also available in the market in the cosmetic clinics for to remove the unwanted hairs over the body. And
Okay.
next is weight
Uh,
control, BMI reduction, obesity reduction, control of diabetes, control of endometrial CA, and other use of OCT, oral contraceptive pills, estrogen and progesterone may reduce the androgen level. So it is another important treatment modalities. OCP, oral contraceptive pills may use metformin, another valuable drug which acts several way and help the PCOS patients. A statin group in cases of uh, hypercholesterolemia or dyslipidemia patient, statin we can use. Hair growth inhibitors we can use, and there is multi-modalities treatment facility. Number one is general practitioner's help. We need it for early detection of PCOS or Steen-Leventhal syndrome. General practitioner's role is very vital. They will investigate the USG whole abdomen, by upper abdomen, by lower abdomen, and thus we can detect many diseases. So role of general practitioners is very important. Next comes to gynecologist and obstetrician's decision regarding the treatment of PCOS. Endocrinologist's role following gynecologist role. Next is dietitian role. That is very important. And physical coaches, which they will train how to reduce the body weight, how to keep fit, and dietitians will detect how much amount of carbohydrates, proteins, fats, DGLV, dark green leafy vegetables, antioxidants, macro elements, trace elements, how much amount we will take to control our body weight as well as the PCOS condition. And thus we can, if we can reduce the 10% of the body weight, at least the menstrual irregularity, dysregularity will comes into the regular ways. So
Uh,
body weight
yeah, Dr.
maintenance is
Maulik,
very important.
I would like to interview you for a while here. Like you have mentioned, the very importance of general practitioners and visiting a gynecologist if a lady is suffering from PCOS. According to you, like it would really benefit our viewers to know, because it has been reported that many ladies they suffer from PCOS, but they do not go to a particular they do not go to the specialist right time, and that delays the entire thing and creates further complications. So Dr. Maulik, I would like to ask you, what do you have to say this to our viewers, like how fast, or I would say what would be the time when they should exactly go to a gynecologist and start start getting to know what exactly is happening to them, because since you have explained the symptoms to us, can you tell us specifically on that?
PCOS is the mainly the disease of the reproductive age group, that
Okay.
is 15 to 44 years in our country. And the youngest case we detect is age at the age of 11 years, and second decades and third decades, 20s and 30s, is the main suffering time of PCOS. This disease can last at least 10 to 20 years, and
Okay.
after menopause or perimenopause, this disease will automatically vanish. So we have to deal the matter within this age group patient, and early attendance to a gynecologist or at least the general practitioner's clinic is essential and mandatory. That is the take home message. Early detection, early treatment is the rule to tackle the PCOS conditions and the sick PCOS.
Thank you so much, Dr. Maulik,
Thank
for
you.
answering that. Now, you have already mentioned few important points that what are the various modalities, treatment modalities that you have mentioned. So you were mentioning about the oral contraceptive pills consumption at a very large segment. So now we all know that many ladies who are suffering from PCOS, consistent popping of pills, but also simultaneously you did mention that how lifestyle modifications and certain lifestyle modifications that you have mentioned can really help in reversing PCOS and help them combat this issue. So, from you, from an expert, we would like to get to know, few very important lifestyle modifications that you suggest to your patients, that they should follow, and so that they can reverse the condition. And secondly, we would like to know, like, are there certain signs through which they can know that their PCOS is being reversed?
Number one, the weight reduction, number one, and avoid sugar, sweet. Sweet is a sweet poison. Sugary drink, you have to avoid this first. Fried foods, second, and processed meats and sauces. This is very vital. Refined carbs like sugar, cane sugar, sweets. These are the very dangerous, and trans fat. These are the very dangerous thing for PCOS. And you take as much as possible fruits and DGLV, dark leafy green vegetables. You may take 500 grams per day at least, fruits and vegetables. Seasonal, of course, seasonal. Our country is poor country, so I am always telling you the locally available, cheap and seasonally available fruits and vegetables you should take. And vegetables is full of antioxidants which will protect you not only from PCOS but also from cancers, heart attack, and other metabolic syndromes. So, and 80% metabolic disease will depends on food. So we can halt or pause this hand before taking the food. Number one. Number two, regular for 30 to 45 minutes walking at least. or 15 minutes swimming, or 15 to 20 minutes cycling, or 15 to 20 minutes running. This is absolutely necessary to keep good health, to become a fit person physically, mentally, socially, and your performance index will be as high as possible. Please keep it for the sake of not for your, not only for your family but also for your country. This is my take home message. This is my last directives in this webinar.
Thank you so much, Dr. Maulik. Now, also, we would like to understand that, let's say a lady has been trying, with all the modifications, she's trying her best to, combat this issue. Are there any kind of signs that, that can tell the lady, okay, this is working? Her PCOS is reversing, and apart from the first, I think, sign that her periods are getting regular now. Are there anything else that you would like to tell our viewers that they can know?
I will tell you one example.
Yes.
My close friend's daughter is a medical student. He have PCOS detected by a professor of radiology of Calcutta, Professor Rejaul Karim, detected that.
Okay.
I advise her two words. You are taking processed foods 300 grams per day. Please cut short it, 150 grams, and walk 4 kilometers per day. Her cycle became regular, her weight reduced 20 kg within 6 months. This will
Okay.
happen. You restrict your carbs, carbohydrate, and trans fat, and increase the voluminous foods with fruits and vegetables.
Okay.
You may take egg, boiled egg. You may take double toned milk or skimmed milk. This is the uh, main things. Everybody will tell you you will do that, these, those, that. Not required. Simple thing. Restrict your carbohydrate, increase your protein up to 1 gram per kg per day in 3 to 4 divided doses. And fat 30 to 35%, protein 15%, 10 to 15%, and carbs, restrict your carbs intake less than 50. That will decrease your weight, that will decrease your BMI, that will control your cycle.
Great.
A female will be fertile lady, ovulatory lady within 6 months. This is the take home
Great.
message. I felt it, I have seen it.
Thank you, Dr. Maulik. I'm sure the wonderful insights that you've given us today, and in a very simpler terms, would really benefit all our viewers who's watching a video today and who will be watching it further. Dr. Maulik, with your permission, we are getting few questions in the comment section and also in the inbox. Can we take a few questions, sir? All right.
Anything from audience?
Yes. So we have got a question from Mr. Manikanta. Even after menopause, women with PCOS often continue to have high levels of androgens. Doctor, please tell me about this.
It is common sense. Uh, After menopause, estrogen, most of the estrogen present there, but most of the estrogenic effect will vanishes. It is common. Progesterone takes upper hand due to handicapness of estrogen, and androgen will come into action. Following menopause, the 70s, 80s ladies will see like a male. In many cases, I have seen it.
Okay.
Grandmother, grandpa, grandma, almost seen like a male. Male change due to androgenic upper hand. Due to lack of handicapness of estrogen. So hormonal therapy, HRT is there. After
Okay.
observing every risk factor, after seeing every risk factor, you can start HRT at the age of postmenopausal lady. After proper and thorough medical examination, of course. It is the imbalance, endocrinological imbalance. Simply,
All right. Thank you so much, Dr. Maulik, for answering that question. And thanks, Mr. Manikanta, for being with us today. We have another question from Mr. JC Chatterjee. Will having PCOS affect the outcome of patients? I think in IVF, that's what he's trying to ask.
in vitro fertilization and embryo transfer, IVF and ET, it is the last resort of infertility in cases of PCOS, severe degree, which cannot be treated, which cannot be changed, it cannot be reversed, the PCOS condition. The last court of appeal is IVF and ET. It can be done after ovum peaking, healthy ovum peaking. Of course, healthy.
Okay, thank you, Dr. Maulik, and thank you, Mr. Chatterjee. So we have got a question. I think this would be the last question that we would like to take. We've got a question from Miss Monica in our inbox. She's trying to ask. I have heard a lot that we need to reduce drinking milk and certain fruits in order to reduce PCOS. Is that true?
You can take double skimmed milk or double toned or skimmed milk. You simply boil the milk and take in a can or jar and keep it in a refrigerator overnight. नेक्स्ट मॉर्निंग यू विल मलाई हटाओ दो, निकाल दो मलाई को, क्रीम को हटा दो, वो बोलेगा कि क्रीमलेस मिल्क will be helpful. Or after boiling the milk, cream layer, first time, second time, third time, you will discard this, you take the milk. Milk contains cholesterol. इसलिए कोलेस्टेरॉल माइनस कोलेस्टेरॉल मिल्क नहीं होगा. एनिमल origin, milk comes from animal origin. So we discard this, we regarded it as animal food and full of cholesterol, creams, saturated fats, these things. So minus these things, you should take liters of milk.
Thank you, Dr. Maulik, and thank you, Miss Monica, for answering that question and being with us today. With this, I think, Dr. Maulik, it was a wonderful discussion with you, sir. I once again thank you for your time and being with us in our show today. Thank you so much, and I'm sure a lot of people will be benefited from this discussion and your wonderful insights. Thank you so much. I would also like to thank all the viewers who are watching this video with us today, and I would like to also request that if you feel this particular discussion and the topic would interest and would help any of your friends, relatives, do share this video with them. And if you like us, if you would want us to come back with more such topics, please do write to us in www.pubertytomenopause.com. We will ensure to bring the experts from leading experts from our country with similar topics in the next series of We Talk Do You. With this, I thank everyone and wish everyone a very good evening. Thank you so much for joining in. Thank you so much, Dr. Molly.
Thank you. Thank you.